Hi Chem 112ers, today we will be talking to you about a harmless photochemical cancer treatment that utilizes concepts we know in quantum chemistry. This treatment is called Photodynamic Therapy, or Pdt. Currently, Pdt is being clinically used for early stages of tumor cell accumulation. The Pdt process involves a molecule called a photosensitizer being excited by a source of light. Photosensitizers are molecules that can both absorb and transfer radiant energy to a reactant, like oxygen. The use of a photosensitizer allows transfer of electrons to an oxygen-filled species, like our cells. Within our cells, oxygen diffuses rapidly through our cells' membranes. The type of oxygen that is diffused is a ground-state diatomic molecule, which is relatively unreactive. Pdt utilizes the source of oxygen, but manipulates its reactivity by using a photosensitizer. The input of a light source causes an excited photosensitizer singlet state, which is then followed by the conversion to a long-lived excited triplet state. After this state has gone through photochemical reactions in the presence of oxygen, it will generate transient levels of reactive oxygen species, which will then have the capability to destroy cancer cells as well as other pathogenic microbes. Ground-state molecular oxygen is relatively unreactive, and in contrast, a singlet oxygen can be made by an excited photosensitizer's energy from a photon of light that converts the ground-state oxygen to an oxygen-reactive species. By referring to this Jablonski diagram, the ground singlet state of the photosensitizer is excited to an excited single state, which is then be able to react with an oxygen molecule, transferring its electrons to create a hydroxyl radical, or transferring its energy to create an oxidative reactive species. In most photosensitizers, the excited singlet state rapidly undergoes a process known as intersystem crossing, in which there is a transition to a lower energy level as the spin of an electron flips. The spin flip puts the molecule into a triplet state. These oxygen-reactive species are singlet oxygen atoms that reacts with certain biological substrates, such as lipids and proteins. This restricts the ability of a singlet oxygen to diffuse great distances within our cells. The restriction causes a photochemical oxidation of proteins and lipids, forcing the cell to undergo cellular apoptosis, or programmed cell death. In clinical tests, the presence of photosensitizers can be visibly seen as the photosensitizer returns to its ground singlet state, emitting fluorescence.
Now that we know how Pdt works, we will observe the clinical process of Pdt. The procedure of photodynamic therapy, Pdt, is really simple and is divided into 3 steps. Step 1 is the injection of photosynthesizer drug into the stream. There are a lot of photosynthesizers used nowadays, but the most common photosynthesizers are porphyrin and bacteria chlorine. Step 2 is the incubation period, which is also known as the waiting time. During this time, patient waits before going back to the doctor's office. So basically, during this period, you are just waiting before going back to see your doctor. In step 3 is the light activation step, which is the light is shined at certain wavelength at the affected area to kill cancerous cells. The photosynthesizers in the tumor absorbs the light and produces an active form of oxygen that destroys nearby cells. Pdt is performed as outpatient procedure. It means that it does not require you to stay at a hospital. Once the person is treated, the recovery takes very little time. But however, some side effects are observed. Most common side effects are swelling, rash, and redness. These are observed due to the treatment of your tumor. The treatment temporarily makes you more sensitive to light, which causes these effects, but avoiding sunlight for a few days resolves this issue, and after some time, your body is no longer more sensitive to light, so you go back.
With all of this in mind, one may ask, how is this all related to quantum chemistry? Photodynamic therapy relates to quantum chemistry primarily in 2 ways, through the mechanism of the photoelectric effect and through the example of the particle-in-a-box model. The photoelectric effect is the observation that when light of a specific wavelength is exposed to a surface of a material, some material is able to emit electrons perpendicular to its surface. This observation stems off the idea of quantization, wherein discrete packets of energy are able to manifest themselves physically in the form of a particle known as photons. These photons, when emitted onto a surface, are then able to interact with the material present and allow for the emission of an electron. This observation is related to photodynamic therapy, as both utilize the same mechanism to achieve an electron emission. The differences in this case being the application, where photodynamic therapy is interested in the excitation of photosensitizers, which then radicalize oxygen molecules. The photoelectric effect is applied towards the emission of electrons with varying kinetic energies. The particle in the box is a model which places a particle into an infinite potential energy well and is allowed to move freely through the box but cannot penetrate the well walls. This model is used to simulate a freely moving particle in an impenetrable box. However, when a potential energy is applied inside the box in the form of a perturbation, this model can easily be used to understand how a particle reacts to the new system. This particle in the box model can be applied to photodynamic therapy, specifically in the modeling of the photosensitizers. If we were to treat the electron as free to move around the box, but place a photosensitizer molecule as the perturbation to this model, the excitation energies of the photosensitizers can be calculated, and therefore the overall required wavelength of light required for treatment can be found as well. In short, while the usage of the photoelectric effect and of the particle in the box model are only a few methods used to describe how photosensitizers function, most quantum mechanical methods, including the variational principle, the rigid rotor, and many more, are just as valid to describe the mechanisms and properties of the various elements of photodynamic therapy.
The future of photodynamic therapy is being tested throughout clinical trials in labs across the world. One example of this are clinical trials of lung cancer in Russia, where Pdt is being combined with high-dose rate brachytherapy. Results in these trials have shown increased tumor control in patients. Because Pdt is a low-invasive process with low cosmetic effects, the integration of Pdt to couple with other cancer treatments is being highly prioritized for cancer treatment development and is the main focus for the future of Pdt. Since Pdt does have specific limitations, which include attacking large cancer-affected areas, pairing Pdt with another cancer treatment would help treat the entirety of the cancer. Studying the optimal dosages and improving light compounds for specific cancers are also a high priority for Pdt development. With a greater rate of success in patients already treated with Pdt, along with other treatments being recorded in chemical trials today, integration of Pdt will be an integral part of cancer treatments for the future. The utilization of Pdt today has already opened many avenues for cancer treatment, and the future of Pdt will lead the way to establish harmless forms of cancer treatment.